Hi, good morning, everybody. Happy Friday. Welcome to the Partnerships Facebook Live. My name is Julie Yerkes, and I'm the Community Engagement Lead for the Partnership at Drug Free New Hampshire. So thanks for joining us for this Facebook Friday, where we explore emerging topics and current prevention initiatives around the state of New Hampshire. And if you're watching live, let us know. Let us know where you're from and your organization or just why you're joining us today. And be sure to ask questions. We're definitely happy to answer anything as it comes up. So May is Mental Health Awareness Month. And the partnership really focuses a lot on mental health because more and more over the last decade or so, we've learned so much about how mental health and substance misuse are connected, right? We know that, and this is kind of simply put, okay, but we know that substance use can cause and compound mental health challenges and vice versa, right? One may use substances consciously or subconsciously to address some of their mental health challenges that they're experiencing. Some words you may be familiar with are like coping or self-medication. So there are a lot of resources for mental health and mental health awareness month in general, and we're going to be putting those in the chat so you could learn more about those. I do want to say that I am not a mental health professional. I am a substance misuse prevention professional. So I want to say that, okay? If you or someone you know are experiencing a mental health related challenge or crisis, you can dial 988. And Julianne's going to put that in the chat as well to speak to a crisis counselor or even, for information or support for yourself or a loved one. So it's, if there's a medical emergency and you need immediate physical response for someone, you still want to call 911. But if you have a mental health or substance use related question or need support or a challenge, you can call 988, and the crisis counselors can help. So that's my intro. And now we're really pleased to have Kendra Lewis with us today. Kendra is the Youth and Family Resiliency State Specialist at the UNH Extension and a professor at UNH. Kendra has deep roots in positive youth development, really through 4-H, and brings all that knowledge and skill and passion to the students at UNH and the communities around the state. And I've been working with her since kind of the beginning when you first arrived, and really have you here today. So
thanks.
Thanks for joining us.
Yeah, thank you. I'm happy to be here.
So Kendra, we've heard a lot nationally about concerns about the state of mental health in the U.S. And in fact, just this week, the Surgeon General came out with a advisory or a report that really emphasized that loneliness is an epidemic in this country and really impacting our collective mental health. And so I wanted to ask you, what challenges are we facing in New Hampshire concerning mental health?
Yeah, so for youth, as some of you might know, that every 2 years we have youth take a youth risk behavior survey, and that survey has been showing that mental health rates have been climbing in New Hampshire. And so from the most recent data, we see that 44% of our youth have felt sad or hopeless for the last 2 weeks, and that's impacting their daily lives. Nearly 25% have considered suicide. 19% have actually made a plan for attempting suicide, and nearly 10% of youth have actually attempted suicide. And these rates are even higher for girls and for members of the LGBTQ community. So these rates are just really heartbreaking and staggering. And then at the other end of the age spectrum, particularly for older adults, we're seeing more social isolation and loneliness, as you've pointed out with the Surgeon General's report. New Hampshire has the second highest median age in the United States, and that continues to grow. So our population here in New Hampshire is aging. So social isolation and loneliness are particularly going to be an issue as we're getting older. And we see that that has major impacts on our health. So social isolation and loneliness can shorten our lifespan. It can impact our exercise habits and our sleep habits, which have, implications for our health, and can also increase our risk for chronic diseases. So those are some of the challenges that we're seeing specifically here in New Hampshire.
A lot. Thank you. And, I work a lot around adolescents, so though I see those numbers, and the Surgeon General also talks about that at a national level, that there's a lot, and maybe we can link to that, an interview with him, because I thought it was really quite interesting, and he really gives some tips on what we can be doing. So and then I do want to just highlight, and I think maybe Julianne can help us and put the chat for this in the chat as well, that speaking of that higher rate for members of the LGBTQ plus community, at 10 o'clock today, the partnership is hosting their bi-monthly convening, and we're having the Seacoast Outright join us to talk about allyship and really how bias and stigma impact the mental health of our young people and adults in the LGBTQ plus community. So I think those are really tightly connected. So maybe some of you today will join us, and we will have access to that information after as well. So thank you. So we're all, we're working on this. Share with us what strategies UNH Extension is taking to help address these challenges.
Sure. So we have a lot of great programs that can all contribute to our positive mental health. And we have a few specialists throughout the state that are developing and implementing these programs and trainings and workshops. So I know Julianne's going to put a link in the chat that is to our general health and well-being team. So we've got a nice team here at UNH Extension that's just focused on promoting health and well-being of our residents across the state. There's two programs in particular that I'd love to highlight. The first one is our Building Community Resilience Project. So with this one, we're working with coalitions in the Kearsarge, Mascoma, and Haverhill areas to address health challenges in these rural communities, particularly that they've faced as a result of the pandemic. So we've worked with those coalitions in the communities to identify what are the needs that they have, but also what are the assets that they bring to their community, and then setting priorities to address those, the major needs that they've identified. So some of the examples have been things like social isolation, increasing community connectedness and feeling that cohesive feeling with their community, addressing the underemployment or unemployment rates that might be particularly high in rural areas. So some of the projects that the communities have come up with is they've done community events to bring people together. One of them was a senior center that had their community room locked because of COVID for like 2 years. And then it was opened up again, and they had an event there, and people were just so excited to be together and see each other again. In Mascoma, they've created some resource guides and kind of family kits for new families with parents with new babies, and what are the resources in the community that are available to them that they can get some support. And in Haverhill, they did a photo challenge where they focused on the hope in their community. So it was a Hope in Haverhill community challenge and photo challenge, and they said, these are the photos that bring me hope in my community. And they also did a park revitalization project. So a lot of great things happening in those communities, and I think a link will be shared so you can learn more about those if you'd like to. The second program I want to talk about is the mental health first aid program. So this is like CPR, but for mental health. So it teaches people how to recognize signs and symptoms of mental health or substance use challenges, and how to help someone who might be in crisis or is showing signs of maybe needing some professional help. So it gives us the skills to be able to provide them support in that time until they can get that professional help. So if we, think about CPR, you might recognize, okay, somebody needs these life-saving skills until the medical professionals can get here, right? Mental health first aid is the same. We're providing that support and that appropriate help until a medical professional or a counseling professional can get there, and provide them support, or until the crisis resolves.
That is wonderful, because we know how overwhelmed, right? We hear this all the time, like how overwhelmed our mental health providers are and system is, and there are more challenges and crises than there are folks to be able to respond. And so I think this is such a great and important program that you guys have brought. Can you tell us a little bit more about it? So that's sort of a big picture of it, very general, but I'd love to hear more about it. Who is the intended audience? What are some of the goals and the outcomes? And just tell us more.
Sure. So mental health first aid is really for any adult. I say anybody should be taking this course. So any adult that lives with or works with or cares for youth and adults. So there's a couple different versions of the program. So the youth program is for adults. It's not for youth, but it's for adults that really interact with youth on a daily basis, right? Or act really like teenagers is kind of the target age, but really, any youth would be applicable. So we might think of people like school staff, right? They're seeing youth on a regular basis, or after school program staff, librarians, church or spiritual leaders, bus drivers, and obviously parents and guardians. So then they can be prepared and recognizing, is this youth having a challenge or a crisis at this moment? When we think about the adult spectrum, we might see this might be more first responders, law enforcement, healthcare providers, employers or colleagues. And again, anybody who, we all interact with adults at any time, right? So it could be relevant for anybody in that regard. And then there's also a teen program, which is a peer-to-peer program. So this is for teens who are in 10th through 12th grade, and they learn to then also be that support for their peers. Again, we're not providing any counseling services, as you pointed out earlier. We're not professionals here, but the teens are learning, how can I help my peers if they're struggling, and get them to an adult who can then further help them. So the teens also learn then, what are the resources within our school and within our community? So if I have a friend or a peer that's struggling, I can get them to that adult, to that resource. So again, we're all interacting with people all day. So we never know when this could be useful. So that's why I say this course is really for anybody. The goals of the program are to increase our mental health literacy. So let's increase our knowledge and our skill set around mental health. What do we know? And it teaches about what are the common mental health challenges that we see, and what are those signs and symptoms. Another goal is to decrease the stigma associated with mental health and substance use. We've been talking about it a lot more, especially since the pandemic, but there's still a big stigma, right? And we need to break that down. It's still really hard for people to get help, and part of that is because of the stigma. And so this program can help decrease that by teaching us all to, by increasing our skills and increasing our awareness, then we are helping decrease the stigma of mental health in our communities. So then again, it's also going to increase our knowledge and our skills, again, about recognizing those signs and symptoms about a mental health crisis, or maybe a substance use challenge. And it teaches a 5-step plan on how to kind of support somebody who might be experiencing a challenge or a crisis. And so it can go through that plan, and so then people can actually use that plan as they are trying to support somebody. It is an all-day course. It's a long course. It's an 8-hour training, just like CPR. It's quite a bit, but it's a wonderful course, and it can be done virtually or in person. We have both options.
Wow, that is great. So increasing literacy, really giving us some language around this.
Yeah.
I have to say, mental health is, I think for so many, including myself, right? I don't know what to say.
Right.
I
Right.
can, like I can kind of see sometimes that, but how do you respond to that, right? I don't know what to say. I know, and I love that it gives really that high end CPR part, right? Like that high,
Yeah.
further down the road, first aid, um, responding in a crisis situation, preventing a crisis, responding to something pretty severe. But when I've taken it, I also really appreciated being able to even respond earlier to those
Yeah.
early warning signs, when
Mhm.
just supporting our young people when they're starting to feel
Yes.
lonely,
Mhm.
starting to feel isolated, starting to feel, um, really, um, I don't know, separate than,
Yeah.
out from,
Mhm.
So I
Yeah.
really appreciated that. And
Yeah.
I think we as adults probably see that even more often than the deeper challenges and crises, right, in our everyday
Mhm.
lives. We might be seeing, it's kind of like I've responded to more boo-boos, right, with
Right.
hydrogen peroxide and Band-Aids than I have, a tourniquet and, getting somebody
Right.
to ER.
Right.
And
Mhm.
um, and the proper response to that could prevent,
Mhm.
needing to go down the road. So
Right. Yeah.
I really appreciated. Obviously, I've taken the training, and I'm a big fan of it. And both as a professional, who wanted to elevate this work of partners, but also personally, as a mother, as a adolescent development specialist, somebody who loves young people, and have
Yeah.
them around me all the time.
Mhm.
Through my kids' friends or through volunteer work. I really wanted to be able to do it, both personally and professionally. So I'm curious, how's this been received? How's the landscape of all these various mental health first aid opportunities to really, this is like grassroots, right? Getting more
Mhm.
people understanding, working together, to
Mhm.
relieve, right? Or to prevent,
Mhm.
needing to go, um, into the challenge or the sorry, this is not, and I'm going off my notes here, guys. The overwhelmed professional system, I guess is what I'm saying, right?
Yeah. Mhm.
So how's it been received? What's the impact been on New Hampshire?
Yeah, we've had a wonderful reception for it. We've had both support for financial support to deliver the program, and we've had so many, different like people and organizations that want to take the class. Every time we do a presentation somewhere, we usually end up getting flooded with requests pretty quickly of people wanting to be a part of the course, to either have a training come to their organization or they want to take the class. And so we've been we've been kind of coordinating and been a kind of centralized place for both youth and adult mental health first aid in the state for about the last 2 years. There's other people doing it outside of what UNH Extension has been coordinating, like the community mental health centers. A lot of them have trained people at their organizations. But us specifically, UNH Extension, we've trained almost 120 people in youth, adult, or teen mental health first aid. So those are people, instructors who can go out and teach the course. And then in terms of participants, we've had about 1,600 over the last 2 years. And so the program I know has been implemented a lot longer than that, at least since 2016. So there's more people than that in New Hampshire that have been trained, which is great. And we're seeing, especially through the pandemic and through people being more open to talking about mental health, we are seeing a lot more people saying, "Okay, we want to have this training, and we want to be able to, support our young people, support the adults that we live with and work with and care about." So I have a couple testimonials if I can read those as well. These are
Yeah, absolutely.
They're so touching. Before I get to that, I can share too that we've had wonderful results in terms of evaluation. So about 98 to 99% of our participants say, you know, they feel more confident in being able to talk to somebody and just starting that conversation. Like you said, what do I say? Right. And that's something that you get to do with this class of, you know, other people in the course. You can find out, well, what words are most genuine to me, because there's, you know, you might be able to find some suggestions of how you start conversations, but maybe that's like, that's not language I use, that's not comfortable. So you have this opportunity to brainstorm with people and figure out, how can I start that conversation? You know, people feel confident that they can recognize those signs and symptoms, and that they can direct people to the appropriate help and getting them those resources. So really being able to follow through that action plan and support people in their in whatever they're experiencing. So one
Can,
testimonial is
can I
oh
provide
yeah,
my
sure.
own testimonial before
Yes,
you start
please.
reading some?
Yes,
So
please
that
do.
just brings up like that confidence. Yeah, it's so I took the class, and then um what I love about it, and I know this from teaching, right? I know from teaching that if you actually have people practice, they're going to feel more confident to do something, right? So it's
Mhm.
you know, it's teach, show, do, or you know, there's something. It's been a while since I've been. So I I really appreciated that we had to say out loud some really hard things
Mhm.
that even right now I'm getting goosebumps. Like we had to say
Yeah.
out loud, are you thinking about killing yourself?
Mhm.
And look at me. It was hard to
It's
say
hard.
without
Mhm.
shaking and doing this. I mean, now I've said it a bunch of times out loud in this story that I tell people, and I'm still doing it. Um,
Mhm.
so I think we have this fear. I mean, it's such a hard thing to ask, and I don't know what it is. If it's you're really worried about the response, because then you're not
Mhm.
going to know what to do, right? And this course
Right.
gives you that power to feel confident. It really empowers you. And so I'll be honest, I used it the next day after the day that I took the course. And I told the
Mhm.
story a couple times that night, and that how impactful it was. And then the next morning, there was somebody that I'd been concerned about for quite a while, and I went and talked to them. And you know, sad, you know, concerningly, but early enough, they, you know, the response was yes. And I had the steps. I was confident to know what to do, and I was strong and calm, and the outcomes were really good. So I can't say enough about it. And then I signed up to be a trainer immediately, because I was like, this
You
has to.
did. You did. I remember that.
So
Yes.
that's my
No.
personal testimony, and I can't say enough about it. Just that strength to ask somebody how they're doing.
Mhm.
Period. And we know
Yeah.
from our data, we know that our young people do not think that they in this year's YRBS, there was a great question about, um, do you have somebody to talk to
Mhm.
about, are your emotional needs being met by a caring adult?
Mhm.
Their, you know, their
Mhm.
food, shelter, everything. The response was very high, and but the response rate for our, do you have somebody that you can talk to about when you're feeling blue? The
Mhm.
response was pretty sadly low. So
Mhm.
anyhow,
Yeah.
okay, that's my testimonial. Share
Yeah,
some.
no, thank you. Thank you so much for sharing your story. It's so I get goosebumps and tear up every time that I've it's not the first time I've heard your story. And I tear up when I hear it. And something you said earlier and again kind of touched on here too is that really this program is designed to be that really, really early intervention. Like that's when it works, is it's we really want to catch these as soon as we can and start getting help that we can as early as we can so that we can try and avoid some more drastic outcomes that somebody might potentially have. You were able to talk to somebody and catch things before they escalated. So that's great. So a couple other folks, some things that they've said is that the mental health first aid training program has helped me in so many ways to connect to others. I now have the tools to be able to ask open-ended questions non-judgmentally, which has helped others open up and engage with me. I love being able to offer support, teach about available resources, and make connections. My 17-year-old son has noticed how therapeutic my words are and wants to participate in the program so he can make a difference. So that one, I love that, not only can the person tell the difference, but other people can also recognize how powerful that training has been for them. Another one that that would touch my heart when I read it was, this was one of the most relevant classes I've taken. Not only is mental health lacking the treatment services, it is still suffering a strongly stigmatized society. I have yet to meet a person who has not struggled with mental health at one point or another, and this class is a well-organized beginning to the mental health education everybody needs. And I would completely agree with everything that person said, that this is such a good way to just start. If you don't know where to start in your journey of helping and supporting people in their mental health challenges, or helping create a destigmatized society where we can openly talk about and address mental health, this class is a great place to start. It's a safe space to learn about the state of mental health and what you can do to support people.
Thank you. And two things came, this also self-stigma, right? Like,
yeah.
I think, I imagine, I would also say this was true for my experience. I would imagine that folks take this and, there's some introspection here, right? There's some understanding of their own journey and maybe some grace given to oneself about the experiences that they've had and the feelings that they may have. And I don't want to lose sight of the fact that this course also looks at substance use, right?
Yes.
And early use and further down heavy use in ways that we can identify, support. And again, I think our young people are almost always met with punitive responses, angry responses to experimentation, early use, or too permissive, and not curious. Curiosity, why? Why are you feeling the need to use? Because again, what we said at the beginning, there's often a connection between using substances and some social or emotional challenges that they're having. So, because they know it's not safe or good for them. So why do you choose to do something? It must feel, gives something, right? So the course kind of also touches on substance use. And so I think it's goes into substance use.
Goes into it.
A really nice opportunity for people to kind of pivot their responses and way they think about young people if they do engage in substance use. So, like we said, 8 hours is a long time. Some of us can do it for our jobs. Some of us can do it because of flexibility in our time or our jobs, but it's not really accessible for all. And so what can we do without the course? What do you want to encourage folks to do to help support our communities and individuals in our communities through this challenge that we're experiencing right now?
Yeah, the simplest thing is, it's simple, but it's also hard, is just ask someone how they're doing. check in, right? Make that connection. We know that having strong connections is a great protective factor for our mental health. So, practice finding those words that are comfortable for you. Just say, hey, how are you doing? Are things okay? And listen back to what the person is saying and express empathy. Ask them open ended questions. Um, some other things you can do are knowing what are the resources in your area, and we at Extension, we have a list. We can put up the link in, or if you go to our mental health first aid page, you'll easily find resources in New Hampshire that you can direct people to. And as you said earlier, don't be afraid to ask them if they are taking their life. It is so hard to ask that question. And a lot of people think that if I ask them, that's going to make them want to do it. And that's not true. So, it's very important to get comfortable asking, are you thinking about taking your life, or do you have a plan? So practice on that. And as you said at the beginning too, if you see that someone is in an immediate crisis or you are in an immediate crisis, call 988. That's another
Yeah.
resource. So those are some
And
things
I
that
think,
someone can do.
yeah, and I think you can, if you're concerned about someone else and not sure what to do, right? And even if it's, you call 988, they'll guide you, they'll
Yep.
help you, they'll give you some ideas of what to say, guide you through that, and provide some
Yep.
resources. So, and then we also have local mental health centers. We have
Yep.
in New Hampshire, we have 211, which is filled with wonderful resources that can support people, once we understand what needs are there, and connecting them to resources. So when Kendra says knowing those resources, look at your local regional public health network page. They have a lot around mental health, substance use, and other resources. Our 211 New Hampshire is a wonderful place to start looking for resources when you need them. And then again, if it's immediate, you call 988 and or 911 if it's a real need to have someone arrive immediately. So thank you all. Thank you, Kendra. Again, I could probably talk about the benefits of this program for much more than a half an hour, but we want people to listen to this. But again, we have a partnership convening today in a half an hour at 10 o'clock. Julianne, I think will have us put that in the link, but that is on, LGBTQ plus, I plus, Allyship 101. It's a great opportunity. If you are like, oh, there's another couple letters on there, I didn't know that. Join us. We'll talk about why and what those mean and how allyship and decreasing bias and stigma can really help protect the mental health of the members of this community, which are all members of our community, right?
Yeah.
And then next week we have a number of events for National Prevention Week. So check us out on the drugfreenewhampshire.org, our events page. We have an event every day next week, learning about our wonderful homegrown New Hampshire prevention programs that are available to engage in your communities. We have our Student Assistance Program Network presenting about what student assistance is at our high schools and our middle schools, and how student assistance works to promote and prevent and promote wellness, prevent negative outcomes and promote wellness in our adolescents. And then tobacco, talking with our young people, how that's an important opportunity and necessary thing to do in order to create connection and keep our young people strong and healthy. And then on Friday, we have Better Now. We'll be screening a short film on the journey of 5 New Hampshire folks through their recognition that it was time to kind of take a look at their substance use and get the support they needed to join the recovery community. And so the partnership partnered with UNH on that. And so we'll be having a panel discussion with 3 of the members of that film and screening the film and talking about, what was important in that realization and journey, and what resources and how can we support each other. So connection, support, those are probably, if you did a word count, those are really the key ones that we're striving for. So thank you so much. Do you have anything you want to share?
I would just,
any events or resources or anything else that you'd like to share before?
I would say that if you're interested in getting trained in the program, either becoming a trainer or just taking a course, there's the link for, just look up mental health first aid at UNH Extension. You'll find us. There's tons of information on our website and a place where you can request a training. So we'd love to hear from you. We'd love to have more people trained. So please also share that with your communities and organizations.
Yeah. Absolutely. Yeah. And I think they're happening every month, right?
Every other month, but we can also find, yep. So we host them every other month. And we can also, if you have a group of at least 5 or more, we can come to you and deliver a course, again, either virtually or in person. We've got trainers all over the state.
Great. Yeah. Thank you. We've kept you a little
Thank you for having me.
Thank you so much for joining us, and everyone have a happy Friday and safe weekend, and we'll see you next time.
Thanks, Julie.